the meeting is scheduled for an hour and a half, and we might need all of that time because we do have a number of issues to bring up. So how shall we start today? Find a pen. Make sure you got that handy. Make sure you got your pad. All right. What do we want to do, Monique, first?
We can just go with your agenda.
Okay, get started with the agenda. Okay, everyone will have received the agenda and the minutes from the last meeting. Did anyone want to add anything to the agenda at this point? Okay.
Raise your virtual hand if you want to add anything to agenda. Just want to let everyone know that Teresa put a comment in the chat to let everyone know that she'll have to leave at 3, and that Ron is most likely at the going to be at the city council meeting today, which starts at 3:30. So that might be why he isn't here right now. So back to you, committee chair Peabody.
All right, then the minutes, are there any corrections or additions to the minutes that were sent out of the last meeting, which was January 27th?
Okay, anyone? Any corrections or anything? Right, okay. No virtual hands.
Okay. There was quite a lot of information about our presentation. You also got a copy of the PowerPoint that was done. I thought that was really nice to be able to do that. Well, first is housing is first thing on our agenda, but as I mentioned, Jen is getting her vaccine and hopefully she'll get here, but I had told her I would move it down on the agenda, and if she gets here, good. If not, I can make that report. So the next thing on the, we could still wait on this, but we can wait on housing. So we'll skip the next one, which has Teresa, and we'll put it in with housing if Jen gets here or whenever we get to that. Okay. Okay. All right. So it's just a little note about update of the state budget items. STEP Virginia is still in the governor's budget, and they expect it to stay there. The $32.2 million that was put back in the governor's budget after it was taken out last year, plus some additional money for administrative work with STEP. Also, funds for permanent supportive housing is in the budget. Discharge planning from the state hospital and crisis. I don't know how that got in there in terms of all the other things that are going on, but that's my understanding of some of the mental health issues that are being funded that we think will go through this year. I also have on the agenda Marcus Alert. How many are you familiar with Marcus Alert? I think Andrea is. Well, during the last General Assembly, they passed funding and a document to go ahead and do this program called Marcus Alert. And it came about because this young man in Richmond had a crisis, and he was when the police came, he was shot and killed. And so this legislation, I'm trying to find my notes, but I can kind of tell you. Here it is. This legislation will change. It will look at all of the previous regulations that had to do with responding to mental health crisis, where the mental health clinician would meet the CIT officer and all the procedures so look at those again and perhaps update those, because now they want to have in many cases, they want to have just the mental health staff go out if it doesn't sound like it's a police crisis, and they want to include a peer support specialist with the staff that would be going out to evaluate some of the crisis situations. And Virginia Beach Department of Behavioral Health CSB has gotten one of the grants to get started on this. And starting next week, they developed a stakeholders group that will be looking at protocols. This is what they're supposed to do. 5 different cities in the state have been designated to do this and get the funding for it to start out. and they'll be looking at protocols for follow through when you get a crisis call. And overall, the Department of Justice and Department of Behavioral Health State will be working together to formulate this. And it's, you know, the protocol, new protocols. And this 5 CSBs have the funding now, and they hope, you know, that within a few years, it can go all over the state. So I don't know if anyone has anything to say about that or not. Andrea, do you have anything to say about that? Can we unmute Andrea?
Sure can. Your mic is now
Sorry.
open, Andrea. It's okay.
Yes, I sure do. Yeah, that is, it sounds good on paper, but when this came out, you know, there's going to be, I would say, kind of somewhat of an uproar from the behavioral health side, because none of them are really prepared to go out without officers. Like they want the clinician to get out of the car first, not the officer. It could be okay if we're together, but this is how my department is looking at it. So there's going to be a lot of adjustments going on in emergency services and possible turnover from what I've heard, that clinicians are don't want to go out to places without the police. I know there's other jurisdictions that have it set up in their communications, 911. When the call comes in, it's immediately sent to clinicians and leave the police out of it, which is some of the wording in the bill. Different people are interpreting it in different ways, but it will definitely be interesting. We're one of the few, if not the only department in the state that already has an ongoing mobile co-responder unit. Everybody, we have someone going out Monday through Friday, 10 hours a day from like 10 to 10. Other jurisdictions have it, but they go out maybe twice a month, 3 times if they have time to do it. So it's not as in place as ours. We're already set up for it.
I was raising my hand.
Oh, that's okay. Thank you, Andrea. I just want to take a moment to recognize that Jen has joined us. So
Great,
hi,
Jen.
Jen. Welcome, Jen.
So glad to be here. I'm sorry I'm late.
But you're here.
All
We're
right.
talking about Marcus Alert right now. So after that, we can go back to housing, or we can wait a bit if you'd like to catch your breath. Well, also on the Marcus Alert, can you hear me?
We can hear you.
All right. I think that's part of the reason they're taking this time to have these stakeholders groups and to set up the protocols. And I don't, you know, I don't even know if I should say it, but I also understood, like Andrea, that in the beginning, some of the reactions were, oh, wow, yes, by the way, I understand that one of the reasons Virginia Beach was chosen is because it already has a team that Andrea is talking about and already has a CIT. In fact, let me throw this in. Our Virginia Beach CIT team people got the state award for the best CIT in the state. Not only had they developed it well in Virginia Beach, but they had helped other jurisdictions around the state to do theirs. And I know Andrea had a big part to play in that, because she's been involved in CIT since it began, and it was in 2008. So back to what was I saying? There was some concern that that, you know, that there already is, there was some concern that the Marcus Alert funds, which came in because this family advocated it for so strongly in Richmond, and so that money went to them, whereas we're still trying to fund STEP Virginia, you know, which is also includes some mobile and also is a comprehensive system. So there was a little concern expressed about that in the beginning too. But I think now that it's been passed and, you know, starting, I think, you know, that we all need to support it and move along, I suppose, and hope for the best.
All right, thank you, Committee Chair Cuban. I have a virtual hand up by Commissioner Stanley. Commissioner Stanley, your mic is open.
Yeah, I just wanted to, first of all, Andrea, congratulate you all, as Tommy said. But second, I think it's going to be critical because we've even felt the push at the General Assembly level, not knowing whether to support the Marcus Alert bill or STEP and how to integrate it. And the same thing is happening with, you know, kind of the defund the police type rhetoric as it moves into the weeds. And so because you've been doing it so long, Andrea, and because so many of us respect you and know that it's done well, I would like to put on our next agenda, if it's okay with the chair, you to have some dialogue with us about how you see this, because, you know, we don't want behavioral health specialists, you know, feeling unsupported. And yet we also don't want to diminish the CIT work that's taken us years to build. And I, as a person who am supposed to be an advocate, am totally confused. So if I'm totally confused, I can't imagine where the average person is going to be. So that's a long-winded way of saying I think we really need the expertise of you and maybe even Jen as we look at how do we become advocates and allies for the best way to be doing this, or maybe even set, you know, a model for the state for how it needs to look, so that both behavioral health specialists and the CIT training gets integrated well. Is that making sense?
Andrea, your mic is open.
Yeah, that makes perfect sense because STEP, I feel very, very strongly about STEP. And if STEP was in place and the services were more accessible to people and waiting times were down, that is gonna divert people from crisis. And preventing crisis, you know, kind of makes the Marcus alert, you know, we won't really need clinicians to go out because people will already be engaged, aside from, you can't cover everything, but so in some respects, it does seem to me like maybe the cart's going before the horse, because we're sending them out and we're going to help you right now, but we're going to take you for same day access and you're still going to wait 4 to 6 weeks to actually have some type of treatment. So if we work on making the treatment, you know, there and having more people at that end so people don't have a long wait list, and also supportive housing, which we're going to get into, it's all those are the facets to prevent crisis. And we work very hardly with behavioral health to try and prevent crisis. So that's what I have to say about that. But I'm very happy to talk to anyone and everyone about it.
Okay, thank you, Andrea. And in response to your statement, Teresa, I see Jen's hand is up. So Jen, your mic is open.
Thank you. I just wanted to tell everybody that Sarah Wilson, who is the Associate Director of NAMI Virginia, she was appointed to the Marcus Commission. And I can certainly ask her if you would like some real hard details about it, to see if she'd be able to come to the next meeting and talk about it.
I think that would be very helpful, Jen. And because we've got kind of the trendsetter experts here, how do we become allies? Because right now I see the Marcus Alert kind of legislation kind of diminishing our progress with STEP. And yet I don't think that's what it's trying to do or designed to do. So we just need to figure out how to integrate it in a helpful way. So
NAMI's stance is that they work in conjunction with each other and they are equally important and they want both funded.
okay,
That's what they're working towards.
that's very helpful for starters.
Yeah.
How do we then make sure that, see, I'm sorry, Tommy, I was just getting my questions answered, but I'll back off and wait for them to do it.
Committee Chair Cuban, your mic is open.
Thank you. I would like to say that the Virginia Beach, the legislation's already been passed and funding. The Virginia Beach Department of Human Services, Behavioral Health, is starting a stakeholders group because Virginia Beach was one of the 5 ones, and they did say they thought they were because of our already good program. Now, it's starting next week. They did ask that a person from the Human Rights Commission serve on that stakeholders group to set up protocols. Starts next Friday. Sylvia asked that I be the person to represent the Human Rights Commission, to be on that committee. And as I said, I think it would be good if either, I mean, you know, Angie Hicks is in charge of that, and they are working on it. I mean, that's what we're doing starting next Friday. So I'm wondering what you think about that. We're going to develop calls. 5 places in Virginia are working on it, and eventually the State Department of Criminal Justice and Mental Health will be doing it together. And so I think there's some of the details, you know, that we might want. And so we can think about if we want somebody at the next meeting. It's kind of not like a matter of do we want it or not. It sounds as though it's there and how can we best work together, you know, with what we need and what we want. Like for STEP Virginia, what do you think? I mean, it's already started and we're going to be represented on the stakeholders task force, I think it's called.
Well, I have a virtual hand up by Chair Neri Strickland. Chair Neri Strickland, your mic is open.
Hi, yeah, Tommy, and Ginger has also been asked to serve, but I got the impression that it was okay to have two people, you as mental health person and Ginger as representative from LGBT. But I don't know enough about this Marcus.
Marcus Alert.
Alert, thank you. Big word that stumped me. But maybe you should help and maybe explain that next meeting, Human Rights Commission as well, the differences and the different levels. Does this supersede everything else because it's state? Or is it just
It's going to be all over the state once they finish doing the protocols and, you know, both departments work on it. But right now, 5 areas of the state have been funded to get started on this. And Virginia Beach is getting started right now, and we'll be representing them. I looked at it. I didn't see anything that was
We're losing you a little bit on your audio, Committee Chair Cubine.
What am I supposed to do?
Do you have like something maybe in front of your mic? Because it sounds like it's being muffled a little bit.
I don't even know where my mic is.
It might be, it might be, well, you have an iMac, correct?
I do.
Because it might be, I know with my laptop is at the top of my screen, but with your Mac, I'm not sure where it is. Do you have anything pressing against one of the speakers?
My cursor was over my hand. Can you hear me better?
Yeah, we can hear you better. I'm not, it might have been something on the sides of your laptop or the back or somewhere that might be covering your mic a little bit. But we hear you fine right now.
Okay, so what was I saying?
Oh, I'm sorry. You were.
Oh,
okay.
I was saying that I looked at the Marcus Alert and I didn't see anything about LGBT, but maybe there was something related. But I know that both of us are on it. They said they were glad to have someone from the mental health task force, and I was glad to do it. But so I'm planning to do it next Friday. And Ginger is too, as I understand. Can you hear me?
Yeah, we can hear you just fine. We can hear you
Okay.
fine. I have a virtual hand up by Vice Chair Jenkott. Vice Chair Jenkott, your mic is open.
Thanks, Dominique. Yes, I've been asked to participate in the focus group representing the LGBT community this Thursday. So there may be different focus groups.
Oh, Thursday?
Yeah.
Really?
The 25th.
That's strange. Maybe
Sarah
I got the wrong.
Wilson. Yeah, Sarah sent me that email, and it originated from our LGBT police liaison, Shelley Meister.
Okay, yours is a state task force, and this one I'm on is local, so that's what it is.
Okay.
So yours would be, Sarah Wilson is from the State Department of NAMI,
Okay.
I think.
Thank
Right,
you,
yeah.
Vice Chair Jenkott. I have a
So
virtual
what do
hand
we
up.
do for the next?
Oh, I'm sorry, Committee Chair Cubine. I have a virtual hand up by Commissioner Stanley. Commissioner Stanley, your mic is open.
Yeah, I'll just withdraw my question because it sounds like it was premature. It sounds like you all are already on it. But Andrea, I just wanted to go on record that I'm really wanting you to maybe give us some of the impression around, with your experience, how you best see this looking as we watch the protocol, and because you've got experience on the ground with both the policing aspect of it, as well as this mobile crisis work. And I'll trust that Jen is going to keep us connected with Wilson and between Tommy and Ginger. So I can wait. I just would kind of like a little bit of your insight about how you think how it would best go. So maybe we could just leave a little agenda time for that, and the rest will unfold. So I'm sorry I got us in the weeds, Tommy. I just had a real concern about this from an advocacy standpoint.
Yeah. Well, no, I think a lot of people aren't really familiar with Marcus Alert, so I think it's good we had this discussion and kind of make everybody more aware and think about some of the concerns, but also realize that it looks like it's going forward. And, we need to understand as best we can. And I think that would be good to put it on the agenda for next time, as you suggested. And Andrea can give us her thoughts on it, as well as if we have anything to report from the 2 meetings that Ginger and I attend, perhaps. Does that sound good? Okay.
Right. Thank you, Commissioner Stanley.
Okay.
Back to you, Committee Chair.
All right. So that was under the update on state budget items. Jen, would you like to go back to housing now? Or do you want to catch some more breaths?
Jen, your mic is open. Are you still with us? I see she has a little, one of those little warning signs in the corner of her video. I'm not sure if she is still with us.
I see her on.
And she just dropped off. I think we lost her.
Oh, she was muted.
Yeah, I think she might have lost connection. No, I just heard a beep. I think that was us losing her. So
why don't we wait and see if she gets back?
Yeah.
Okay, is that okay? All right, the next thing on the agenda was a report on the jail and reentry services coordination pathway FY 2020 annual report. I did send that out, but I think I didn't send it out till last night. And I think everyone on the Human Rights Commission had heard the report from Sheriff Stolley on that. I was just really pleased to see that report. Are you folks with me? I sent that out of what I'm talking about.
We all received it. Yes, we're all good.
Well, as I say, I think we have all been so concerned for so long about how many people are in jails and prisons with mental health, mental illness. And of course, STEP Virginia would help to keep people out to begin with. But insofar as they are in jail and prisons, we are so happy. I was really glad to see the report that came from the jail program. Here it is. They got a grant, and Sheriff Stolley said he gave the grant to the Department of Human Services. And so they have been working together for a year on this new program where they begin in the very beginning, evaluating everyone to see if they have any mental health problems. And along the way, and one of the best things I think is well before time for them to leave, they have made plans and connected them with resources before they leave. And some of the outcomes are that 83% were released with housing in place, 100% had adequate medication, because that used to be a problem. Sometimes they'd have none or prescription or a week, and and they also 71% were engaged in outpatient behavioral health appointments, and 97% did not return to jail. That's 3% recidivism rate. And this is really great. 100% were linked to benefits, which is Medicaid, things like Medicaid, SSI, SNAP, and that kind of things. I don't know if other people who read the report got other, impressions from it. It's a joint program between Behavioral Health Services with the Human Services Department and the general staff. So I don't know if other people who have read it had other impressions, but I just thought it was good. And they have the grant for another year, and after that, they may have to try to get more funding for that. And that might be something we would want to be thinking about advocating for when the time comes.
Yeah, we got a little feedback from you again, Committee Chair Cubine.
Is my computer turned up too high, maybe?
No, I think it's something hitting your mic. I'm gonna do a little Google search and figure out where your mic may be.
Oh,
yeah.
Did y'all hear that? Did you have any
Yeah,
comments?
we hear. Yes, so just want to take a moment first to recognize that Jen has rejoined us. Hi, Jen. We have a virtual hand up by Chair Neer Strickland. Chair Neer Strickland, your mic is open.
Tommy, I just wanted to know if you had heard anything. Mark was following that. Remember, Human Rights Commission, we had an inmate who didn't get his drugs. They were for mental health. He didn't get them for 7 days. He was transferred to Portsmouth, and then he got them over there. I don't think we ever got an answer on that. Would you mind getting with Mark? I think he has another one that is in the same.
I will. I'd be glad to. I will.
Thank
Yeah, because I know that we've tried to work with the jail a long, long time. And it's even going, I think Teresa before me and with me. And sometimes it didn't work out because of the people that were running the medical department. Possibly, I shouldn't say that, but that at the time I was trying to do it, seemed like that, and they're not there. They're not the ones anymore. But I know that it's really important. And I'll be glad to check with him. And also, with the jail, I certainly will be glad to. Okay, I'm losing my agenda. Where is it? All right.
I have another virtual hand up, Chair, Committee Chair Cuban. A virtual hand up by Vice Chair Jencott. Vice Chair Jencott, your mic is open.
Thank you. On 2 points. To answer, Sylvia, your question, Lois did report out to the commission maybe 2 meetings ago that gentleman was then brought back to our jail, and he was all up to date on, he had his medication and everything. So Mark Stevens is following that closely, but things got resolved there. I don't know where it is today, February 23rd, but we did get a report from Lois on that. And the second thing, Tommy, is that, yeah, the report from the sheriff was really good. What my takeaway, or I guess my question on it was about the homeless population, that there was a high percentage of homeless in those numbers. And Mark, I talked to Mark about it, and he's going to follow up with that. He was concerned about that also. It is, I guess it is pretty common, but my focus was on that homeless population. That's all. Thank you.
Thank you, Vice Chair Jencott.
I think that meant that when they came in, they were homeless. And according to their statistics, 83%, what was the percent that had housing when they left? Oh, I put that paper over here. It said 83 were released with housing in place. Of course, that's not everybody though. So yeah, that is still a problem during the first year. Yeah. So that is a question, it is a problem overall, as well as housing for people with mental illness, which we're going to talk about today. Certainly is a big problem.
Yeah. Committee Chair Cuban, I have a virtual hand up by Commissioner Stanley. Commissioner Stanley, your mic is open.
Thanks, Dominique. Yeah, I just wanted to affirm, Tommy, the work that had been done previously, like you said, from way back when with the sheriff. And when we originally started on this, there were so many disconnects, and he was obviously working toward getting this program. And now that it's in place and we've seen the results, I agree. Sylvia, my hand was up. I was going to say, we've had a couple cases that have come before us where the meds are maybe everything's not quite firing on total pistons. And so I think we should go back around now. And I'm grateful that we have Mark as our advocates to do that. But both in that case, it was fine that particular case got resolved, but it only got resolved after lots of advocates, a lot of us making noise about it and recognizing it. So we need to make sure that whatever was taking place that was able to happen, meaning meds weren't able to be given, because there was another case where someone actually completed suicide, because of maybe a mental health issue that hadn't been, diagnosed and that kind of thing. And that case was on a misdemeanor, case. So those are the kinds of things I think it's really critical that we go back around and just follow some of those anecdotal cases, not just to say that they specifically for that case got resolved, but that there is now a better safety net in place for anyone who is addressing that problem. So maybe we could have Mark interface with this committee to be able to do that for us. And I'm saying that, Chair, because you're here. And so if I make that suggestion, maybe you could say that that might be possible. Because I know Mark would be willing to serve in that capacity, both with the homeless population as well as disconnected youth.
That sounds good. I'm sorry. Was I recognized?
No, I just wanted to say thank you to Commissioner Stanley.
Okay.
And
did.
I do have a virtual hand up by Chair Nair Strickland. I don't know if she kept that up from a previous comment. Okay, she has a comment to make. So Chair Nair Strickland, your mic is open.
Yeah, in answer to Ginger, that was resolved, but it was only resolved after, for 7 days, he went without his medications, and no one ever really gave us a good explanation. And I had given cell phone numbers to Mark for him to handle with Lois and with Captain Norris. And I just really found it, if we, the Human Rights Commission, can't get a return answer, what does a person do without an advocate if they're in need? So I think, Teresa, you're right, that we should just keep it on our radar and follow up on it. Maybe not specifically naming that case, but that's a good case. Seven days, and he finally gets his medicine when he's transferred to Portsmouth. So something went awry.
Thank you, Chair Nair Strickland. Okay, and back to you, Committee Chair Cubine.
I also recall that the sheriff said that he had a certain number of people that were discharged before they actually got into treatment. Not discharged, but released, because I think some people are in on a misdemeanor and they get evaluated and they're supposed to go in to the mental health, but their case gets, dismissed or they get bonded out. So that happens to some people too. So they don't really get the services they would have gotten if they'd gotten in jail, I guess, but that's not necessarily that case. But I think that happens sometimes, that it might change what the plan was, because they got bonded out or dismissed from court. That's one issue. Okay, so I'll follow up with Mark on those cases that were of concern. And was there anything else we need to do about our relationship with the jail and working with them at this point? And I'll follow up with Mark, and I don't mind, invest in asking some more what actually happened in this situation, because I guess we didn't really know. So, and I can do that with Lois or someone. They seem open to me. They do, Okay.
I don't see any other virtual hands, Committee Chair Cubine, on the agenda item regarding the jails.
Okay.
So I just popped up a virtual hand by Commissioner Stanley. It's okay, Commissioner Stanley, your mic is open.
Sorry, I do think with the success of that program, with the stats and the data, and we know that we advocated for it and how well it's doing. Do you think that on behalf of the commission, the mental health advocacy group could ask for the commission? I know we congratulated them on just getting the, when we see awards, when we do those kind of things, but I think we should maybe put in that we will hope that this will continue and how we really think this is furthering human rights in that capacity. So Sylvia, once again, this is a question for you and Ginger as chair and vice chair, and Tommy, you have to make the motion to get our committee to lift it. But I think that would really promote this continuation of this kind of program and affirm what those statistics have done for our city, the people in our city. Is that possible?
Chair Nair Strickland, your mic's open.
Oh yeah, well, I'm big on acknowledgements and letters, so yeah, I think that's a good idea. Thanks.
Thank you. All right, thank you, and thank you, Commissioner Stanley. Back to you, Committee Chair Cubine.
That sounds good to me. And is Jen back on?
She is, yes.
All right. Shall we go back up to the first item on the agenda, which was housing? And can you hear me?
Yeah, I can hear you, and Jen's mic is open.
Okay, well, to start out with, we wanted to just recognize that I think we've all known about housing and being a big problem for the homeless, as well as people with mental health problems. We've had a concern about it. we had Natasha, and am I getting an echo?
Yeah, there is an echo. It's from Jen's mic. I just muted her again. I'll unmute you, Jen, as soon as Tommy's finished,
Okay.
so you can speak.
You know, we've had a concern about housing, and especially for people with mental health conditions. And Jen had brought to our attention that they had had so many calls there for people looking for housing for their loved ones who were on the streets and seriously ill. And so we had decided to try to identify what housing resources are available already, you know, and we started off with Human Services Department last meeting, which gave us a lot of great information. And then we said we talked along the way about possibly, Jen had initially talked about going to City Council for some help with this. And we had also talked about, before we would do anything like that, we might try to see if Michael Berlucci could help us. And in the meanwhile, we would be looking for all the other resources and what other things we can do. So Jen has been doing some things, and NAMI has gone ahead and talked with Michael. And so I'm just going to turn it over to Jen where we are right now. I think that's what we said, Jen.
Jen, your mic is open.
Thank you. Yeah, we sure did, Tommy. Thanks for that great summary. So Kay Ashby and I spoke briefly with Michael last week, and he definitely is supportive of the need for more supportive housing. And he said that what he would do is to start with these questions. He said, what are your priorities? And where are the opportunities that might be out there for supportive housing? And then the third thing was, where are we falling short? He has, he volunteered actually to let us all speak before City Council at a private meeting. But obviously we're not there yet in terms of giving them the information they need to get their help. So Tommy asked me if I had data, because right now I'm the NAMI answer phone person, and so I did, and I've got data back from August 26th of last year. So as far as calls just relating to housing, there were 22, but there were 43 calls from people looking for various services, and 36 looking for crisis support. So I think that I know that I can say that some of those 43 people looking for services and 36 for crisis support also had a component of needing housing, either immediately or in the near future. We have calls from relatives of people who are in the psychiatric hospitals, and they say, I cannot take this person back into my home. Where can they go? When they come out of the psychiatric hospital, they're not totally stable. It's like a Band-Aid on a wound. And so while they're in the hospital, they may get a little more stable, but when they come out, if they don't have somewhere to go where supports are in place and they don't have to reach out for them, then more than likely they're going to cycle back through. And so there have been studies done, and I'm actually doing some research into those now, that over the lifetime of a person, it is cost effective to the state to have supportive services in place. So that would mean supportive housing with someone there to make sure that they're taking their meds, to make sure they're going to the therapist and the psychiatrist, and to help with food, and also possibly a job. They're much better outcomes for the people. They become productive citizens rather than a drain on the economy. And I say that in the nicest way because I have a son who is a drain on the economy, but not by choice. And anyway, that's the need. That's the need for housing. And so Kay and I talked after talking to Michael, and we came up with a few things that we wanted to explore. Maybe you all might like to participate or take one of these. One of them is that to look into, do you see any type of vacant office buildings or vacant hotels in your travels that perhaps we could do a public-private partnership with them. You know, an office building would be great because it's already sectioned out, or hotels are even better. It's already sectioned out like into a one-bedroom studio. And so you wouldn't have to reinvent the wheel. So that's one thing. Another thing is, when you're looking, we want to be aware that we need something that in your bus routes, near grocery stores and pharmacies. So it can't be out in the Netherlands, because that's not really going to help unless they have a vehicle that transports people to and from. But part of the thing too is everybody needs socialization, right? I mean, everybody does. And if you have a mental health condition and you are sequestered, it's not going to get any better. And so you need to be able to get out and do things. There's a place called Seaside Harbor Apartments. It's right down at the ocean front in the Vive District. And Samaritan House partnered with the Lawson Company to build that. Those are lower income apartments, really designed for people like, say, a teacher who's just coming out of college, who has very little money and needs to get a boost. But I was thinking, you know, maybe we could contact that company and see if that's something that they may be interested in working on. Another one is Vanguard Landing, which is out on Princess Anne Road. It's like if you're going to Pungo, and it's near that housing development whose name escapes me. But anyway, it's over on the left. It's this great big patch of field, and it was to be developed by Debbie Deere and the city as a place for intellectually challenged people to live. And I don't know what the status on that is. And that's another thing we need to find out. It's been sitting vacant for a long time, but we're wondering if maybe we could partner with the city and Debbie Deere and expand the idea of that to include people with mental illness. So mental illness, developmentally and challenged, and then maybe even elderly there too. I mean, it could be a mixed use community with a little community center and supports in place. So that was another thing that we wanted to look at. The thing that, you know, the thing with mental illness is everybody says, oh, isn't that great to have housing, but not near me. And so our thoughts were that if we could do something where it's joint with the elderly, and I really that term because I am, but anyway, people who are older, and also people with disabilities, then it might be more palatable to the people in the neighborhood, you know? So that may be a way of looking at it too. And how about JCOC? You know, they've got a permit for new supportive housing. So maybe we could talk with Todd Walker and see if that's something that we could go in with them on to expand that. It would help him and it would help our population too. So Michael said that he would talk to Andy Friedman and just get some preliminary information from him. And so he's going to get back with Kay and I and just give us some ideas of what maybe Andy has in his toolbox for this. And then next meeting, we'll be able to discuss this a little bit further. So one other thing that I wanted to mention to you all, there's a gentleman named Corey Trench, and he is with NAMI Williamsburg. He's been working for, I can say years, to develop part of the grounds of Eastern State to create a village, a Hope Family Village. And the idea was that it would be 25 families who have various types of homes in a community, and it would be the family and then the person with the mental health condition. And everybody lives together. Now, I don't mean together, you know, together, but like in their own house. And then the person with the mental illness can either live in the same house or they can have a little house, you know, and they have a community center in the middle. And so it just makes it more of a supportive atmosphere. I'm not necessarily saying that we need to do that, but I think it's a really great idea. He I think, getting to the end of it where the state is possibly going to lease it for $1. There are some people that are now jumping in. I can't remember from, I want to say China, but don't quote me, who maybe want to use that area, and money talks. So I'm not sure how that's going to work. But anyway, if you think that that's something that you all might like to explore at some point, I could certainly ask Corey to talk to the group and give you all the benefit of his experience. He's a really neat guy and so motivated. He even got Tommy Norman to work with him on this. He's from Williamsburg General Assembly, and he's supporting him too. In the meantime, he also has a house that he is, there are 4 people that live in that house. It's a program that's in various parts of the country where they have the 4 people who live in the house. They either have to have a job outside of the house, or as a group, they have a job. And they are fairly self-sufficient. They have the support of a person 10 hours per week if they need it, but they actually run their home by themselves. And I think that's a really cool idea too. So anyway, I've talked enough. So that's my report.
Thank you, Jen. Thank you. Okay, committee chair, Cubine, your mic is open.
Okay, that's really it. That they've done a lot of work on that, and I think that's excellent. I also looked at some possible other resources that are already available. It seems like there's always something popping up about housing, and it's not something maybe we've been familiar with that's housing for this population. In fact, Teresa is on the Virginia Beach Housing Advisory Board, and I don't know what they do, but I'll leave that for now. I don't know if I really need to go over this list, but they're listed. There's permanent supportive housing through the Virginia Supportive Housing Department. They've been, not department, but organization. I know I worked with them before because they built a lot of apartments. Some are in Chesapeake. One is here in Virginia Beach, Crescent Square Apartments. And then there's Community Alternatives Management Group in Virginia Beach that sets up permanent housing in congregate settings. Mentioned Judeo-Christian, there's LGBT Life Center, Veterans Affairs Supportive Housing, Transitional Housing, Virginia Beach Community Development Corporation. So there are a lot of places that, are doing housing, and I don't know if they're available to us or whether we're making use of them. But that was one of the things we had said we wanted to do, was to see what might be available out there, already that we didn't really know about. But so I just have a listing of that. But I think, we'd like some input from you. My thought was, and I told Jen this in advance, was that maybe instead of us starting to, look for, we could do both. But since Michael has said he would meet with Andy Friedman with Department of Housing and Neighborhood Development, it's not exactly right, but and then also he had 3 questions for us to answer. And should we try to answer those questions before he meets with them? And should we wait to hear what Michael has to say, or should we go ahead and start investigating some of these other possible resources and some of the things that Jen said? So what do y'all think? My thought was, if Michael is going to do this, and if we thought our ultimate goal was to go to City Council, maybe we should start with him, or either not just him, but somebody from this task force also meeting with him. I think Andy Friedman has somebody that's designated that really does this kind of thing, but it would be his office. So what are your thoughts on what's the next step here? Got a lot of great possibilities with all that Jen presented, and then some of the resources that are out there that we may not be sure about how available they are to us.
I see a real hand up by Commissioner Stanley. Commissioner Stanley, your mic is open.
Yeah, first of all, Jen, thank you so much, because and I tried to pave the way with the advocacy with Kay and you to make sure that you could vision with Michael a little bit with that conversation. because we need a champion, and now you've got him. And, you know, I'm always thinking like an organizer. So to me, the next is, okay, and I thought I was part of Jen's report, because I thought that making the link with, there is a housing advisory board, believe me, I spent a lot of meetings there. And it is a board of the city that was put together, and so it's city council appointed, similar to the Human Rights Commission. And we do have the single room occupancy units that Tommy referred to. We have advocated for that. That's a regional permanent supportive housing, single room occupancy units. The first one was Gosnold, then we got Cloverleaf, and we got Crescent Square. I can't think of the one in Portsmouth, and another one in Virginia Beach was the, oh gosh, I know these by heart, because every single time it's time to put one in. With this regional expert, we have to fight city council. And the city council has now seen that they're the best thing since sliced bread. It's, you know, 400 or more units of this permanent supportive housing. So I think, Jen, making sure that NAMI has that link and is aware of those whenever there are vacancies, figures out how to utilize those in the pipeline, so that we're finally integrating well, along with Andrea and the CIT work. So that's one piece of it, just making sure that those things that Tommy listed. I've spent the last 30 years trying to make these things happen. So I know what they are, but I know we don't have nearly enough. That much I can tell you. And now Jen's got the data, the calls she's getting. So we make the case that and here's what I'm picking up. Because we're just doing this huge housing study. This board meets monthly, and its whole job is, and I'll give you the 4 duties. And every place that I say workforce housing, substitute affordable housing, because affordable housing is a dirty word. Workforce housing is now a dirty word, but we always have to keep moving the words around, because people think NIMBY, not in my backyard. And so we're trying to get out of that, you know, that ideology, so that we can have affordable housing that meets the needs of all the people that need it. So one, it's to establish the maximum sales and rental prices of all the workforce housing units. That means affordable housing units, and adjusting those annually. So we make sure that they're not too much, even though in Virginia Beach they are, because for the region we're high. 2, advise the city council on all aspects of, and it says workforce, but it's affordable housing program. So that's where we fit. We can become advocates for a need here. I can only help you get access to it because I sit on it. I can't be the one to do this, so we can come and make public comment once we decide what we're doing. Andy is on this, Andy Friedman, as well as other housing and planning and zoning people. So I think this is the avenue, Jen. Organizationally, we've got all the components to work on the remedy. So they advise them on the workforce housing programs that we need, including recommendations for modifications of requirements for any of the programs. And 3, report annually on how the production of those units is going. So I'm always saying that we don't have enough. And then 4 is advise the city manager and city council to implement the strategies to address the issues that are making affordable housing not possible. So that's zoning. So this falls, you know, and there is a meeting monthly, so you can come anytime once you're ready. And there's just procedures for making public comments. So right now it's meeting virtually. So as soon as we decide, like, and Seaside was, it was owned by Seaside Apartments that you referred to, Jen. They were owned by Samaritan. So I would love to put you in touch with Executive Director Robin Gauthier, have a conversation. Steve Lawson, who is a great builder of Lawson Builders, he really is invested in affordable housing. And he was the one that got the tax credits, helped by Andy with the workforce housing of these kind of groups to try to bring down tax, you know, what they call housing tax credits, so that the builders can develop these. So I think if we could just make the case, and I love the idea of seniors and the disability community, which would include mental health, because those are the areas we really don't have enough in. So if we make a case for a project that NAMI and others would support, that could model something like Seaside. And by the way, Seaside, there's an alleyway. It's right in the Vibe District. That's where we're having our mental health wellness space that we're creating with the Season for Nonviolence Collective. Sylvia, you and Ginger were on that club. And remember, you heard about the rocks, you heard about the mural, you
Oh,
heard
yeah.
about
Oh, yeah.
trying to destigmatize by letting people be aware of NAMI and CIT and all of these resources. So this is all being integrated in great ways to include the housing component if we can get there. So I think this is long-winded, but that was my report to tag on to Jen's, because
Yeah, you were on the agenda.
okay, so that's all that I was going to report out. So
Okay.
hopefully that's helpful, Jen, with the research you've been doing.
Thank you, Commissioner Stanley. Committee Chair Cuban, I saw a real hand up by Jen. So Jen, your mic is open.
I just want, well, Teresa, I'm blown away. So that's wonderful. Thank you. And you're such a great advocate. I don't know how you get any sleep, but anyway, I appreciate you. So, so with the supportive housing component, I know we do certainly need housing for people who don't have the money to pay for it. But I would love to see it with like mental health care there. You know, someone where in the middle of the night, if someone's having psychosis, there's somebody there. So that from a NAMI standpoint, that's what we're looking for. And I will share with you all that I have at least a colleague, but he's having a very hard time. He has agoraphobia and he needs to find a new place to live. And so I reached out to several different places and nobody, you know, really could accommodate him, which breaks my heart. But what was my point? My point is that he's been on a list for housing. This is just low cost housing in Portsmouth for 4 or 5 years. And the same with Chesapeake. And we've just, you know, we've got to do a better job of taking care of people who can't take care of themselves. You know, it is right what you all need to, what your mission is. Humanitarian. We've got to be more humanitarian about taking care of people who can't help themselves. Sorry, get off the soapbox.
That's okay. It's okay, Jen. And Teresa, I see you. I see you're responding. So I'm going to open your mic. Your mic is open, Commissioner Stanley.
And Jen, so what you're talking about is creating a model. So once, you know, once you maybe talk to people like Steve Lawson, find a model that we could sell. And what we've got to make sure we're selling is what they think we're needing. And what we know the needs. We just have to get the data together to show that need, and then how it could work. So that's the part that NAMI's got to be the expert at, because I don't know what kinds of support services. I know for like these single room occupancy support units, the people are on site. So I think Virginia Supportive Housing could possibly be a partner. That might be something we want to talk about, because they've got models of it between, you know, right here in Virginia Beach, the Crescent Square and Cloverleaf are 2 examples. Maybe Virginia Supportive Housing would go after a grant using tax credits under the, you know, and maybe make it a public-private partnership, but finding the land, finding the spot, all that, and then working the neighborhood so you don't have those NIMBY issues right out of the gate. It's so complex, but I think that the Affordable Housing Committee needs to be challenged, as well as Andy Friedman and, you know, the Department of Neighborhood Preservation, because until we start creating more models, we're not nearly going to make up for the deficit of all these people, all the people that are needing these supports. So they look what you do and what Andrea does. You know, shelter is the main, housing first. Once people have housing, they can be stabilized. Without housing, they got nothing. They're vulnerable. I don't know how to get there, but I'm here to go with you and help the relationships that I can. And as long as I'm serving on this commission, I might as well, you know.
Thank you.
Okay. Thank you, Jen, and thank you, Commissioner Stanley. Okay, back to you, Committee Chair Cuban. See your virtual hand is up.
Oh, yes. Thank you very much, Teresa. You were on the agenda. And you know, Teresa is a community organizer, so you have to make great help from her. We get great help from her. So at this point, I'm wondering, what is the task force next step? I mentioned that since since Michael had volunteered to meet with Andy Friedman, we might wait till we might get those 3 questions he asked together before he meets with him? Or what would be our next step? I felt like Teresa might be telling us some next steps. What would be I mean, there's a whole lot to be done. What would be our next step?
Commissioner Stanley, I see you, you have something to say. Your mic is open.
I think exactly that, Tommy. Set up a sub task force of the task force, which, you know, the mental health task force is the full group. The sub task force has already been busy. That's, you know, Jen and Kay. Kay is Kay Ashby, who is a mover and shaker, and knows the issue inside and out. And she's also very familiar with Michael Berlucci with Jen. So maybe they could map out a plan. I would want to maybe have a conversation, Jen, with Rob. You all should with Robin Gauthier to see how they did Seaside. What does Seaside have in there? Because I know it is for a disability community. That's what I understood. Andrea, you might know it better than I do. Are there some mental health component disabilities in that apartment complex? Do you know?
Andrea, your mic is open.
Thanks. Yes, in terms of people with PTSD for, you know, having escaped abusive relationships. So they do definitely support people with, you know, counseling, helping to get them on their feet, but really to deal with the traumatic event that brought them to this place and then help set them up in other more permanent housing. Because I've gone to apartments where Samaritan House comes in and finds them an apartment to leave Seaside and then supplies them with everything they need. I mean, that I couldn't believe she had moved in 24 hours the day before and she had 2 kids and had everything. She didn't need any stuff. She was totally there, plus food. So yeah, they have a great model. And then
So-
getting back, go ahead.
So is Seaside, it is permanent housing, correct?
It's emergency housing, but it's not, I don't know. I haven't been there in a while, so I don't know if there's a time frame, but I know that it's for stabilization, but maybe that's 6 to 12 months. So, you know, we're not talking 30 to 60 days, but most people don't live there for years permanently.
Okay, well, I would say then the first step, and thanks, Andrea, because that's more than I knew. The first step would be to get with Robin Gauthier, see how, because it was Samaritan owned, Jen, and they partnered, public-private partnership, and I'm pretty sure it's Steve Lawson, but we would learn all that from Robin. So if the little, and once again, I'm kind of just putting it in motion, and this might not be what you want to do, but from an organizer perspective, I would think, okay, I'm happy to reach out to Robin and try to set up a Zoom conversation so that we could ask her all those questions and see if that's a model that might have some merit for what, you know, NAMI with the mental health housing would be looking for. And then we could ask Robin, she's an expert on homelessness, housing affordability. They develop properties, they run properties, so we could bounce off her all kinds of questions that might help answer those 3 questions Michael Bellucci's looking for. So let's just maybe start with an exploratory discussion. You let me know a good time. I'll try to set it up with Robin. She's very busy, but I think she'd do that for us. And then we could kind of go from there with, you know, then how do we set up, like Tommy's saying, what would be our next steps? How do we, you know, how do we move toward being the strong advocates for what we're looking for? Does that sound like beginning?
Jen, your mic is open.
Yes, it definitely does. I also though want to continue to see if there's anything that's already existing that, because I think it would be faster in the long run, you know, a hotel or an office building that could just be renovated. So I don't want to lose that concept. There may not be anything out there like that, but I still like to look into it.
That's another thing Robin could probably help us with because she's looking for properties all the time. But Sylvia is challenging a little bit with that question. So maybe this, we don't see this as the work that, what do you think, Sylvia? I mean, I don't want to be taking us some, I don't want to be taking us someplace that was not the task of this mental health task force. So
Chair Neri Strickland, I think she's referring to the message in the chat.
Yeah, well, since you, when you said
Oh.
this task force, we're creating a task force. For some reason, we've changed the mental health committee to a mental health task force, or it was a task force and it was a committee, and then it's back to a task force. And in my estimation, I don't see this group going away, nor should it, just becoming more of a human rights issue. So I'll just approach it again. But what you're doing is you're doing what you need to go forward with subcommittees or task force, whatever. What we're called doesn't really matter, except that now with this new idea group, I think it's more important than ever that we have standing committees, that we show that we are here working on this. So I don't know what their role will be, but it'll be interesting.
And Sylvia, maybe that's a thought. Don't call it a task force subcommittee, call it maybe an idea group that's going out there, Jen and Kay and myself, and at least getting some of the background information that would be needed to bring back, to the wider group, and then see what the next steps are from there. Jen, I'm just knowing that that we're as committed as you for the human rights of those that are needing housing. Housing is a basic right, and without it, people can't thrive. So anything you all want to do, but Sylvia, thank you for kind of keeping us on track with how we want to go about the work.
Thank you, Commissioner Stanley. Okay, I saw a real hand up by Andrea. Andrea, your mic is open.
Thanks. I was also on the same lines. There is an organization called Oxford House that is providing housing. It's not really supportive housing in our sense of the word, but Oxford House buys properties, and then individuals looking for housing, same thing, like they can't go back to where they were. Maybe they got out of a substance use rehab and they've burned their family bridges, so they need some place to go. There's usually 3, 4, one time I saw 5 people living in a home individually. They pull their money together to pay for the expenses, and ideally they're there to provide peer support for each other. If someone starts to slip, hey, I'm here for you. Ideally doesn't always work out that way. I know there's 3, maybe 4 in Virginia Beach that are freestanding places, but there is staff, and one of the guys from I guess a regional standpoint, I think I've seen him at IAB meetings, and another meeting he's been at where I've actually sat next to him a few times. So they have a good model that we could look at also. How are they funded? I know they're probably private, have grants, things like that, but that is along one of the models you were talking about, Jen, of having somebody, a house where people can go and live, and they're independent with maybe, I don't know how often a so-called staff member, like a support person, but once you have that, the physical place and it's set up, then the support, can come as we have it. Even if you have, what is it, Cheryl Molinette's group, path workers coming in to check on people, because they're already out there. So that could be our support that's already in existence, and it's one more stop on their schedule. So you're not quite reinventing the wheel, but we're going to go back to the property, where you're going to get the property, who can live there. And maybe, a lot of people have substance use and mental health issues, so it's not a far cry from what Oxford House already has. And if you go in and work with them for developing properties, then we could actually maybe have more of them. And they already have a chain set up to follow.
Thank you, Andrea. And Committee Chair Cuban, I see your hand is up, but we have a virtual hand up by Vice Chair Jencott. Vice Chair Jencott, your mic is open.
Thanks, Dominique. I was wondering if we want to cycle back to Tommy's question to us. We have so much going on. It's just
We
great
do.
conversation. But Tommy asked us kind of what should we do next? And I would like to ask if we should get those 3 questions from Councilman Berlucci, and if that's something that we need to do next to kind of pool our thoughts, and maybe it would be pooling a lot of what was just said by everybody here, all of these great things. Tommy, is that what you were, kind of what you were asking us?
Well, it was initially, that was kind of my recommendation, is the next step for us would be to go ahead with, let him do his, visit and, well, do the questions, answer the questions and do that and then go from there. But I know Teresa has made some other recommendations that sound good about talking with someone who's already developed some, some houses on the seaside. So,
But my feeling is that it's not up to us to be in the trenches with developing the housing, but to give recommendations and to go through Berlucci with those 3 questions would be a powerful place for us to give recommendations, if you can follow what I'm thinking.
Commissioner Stanley, your mic is open.
I just want to finish. Ginger, that's exactly what I was suggesting. Take Michael's questions, use that idea group, and these are the people, these are the experts relationally that would get us the answers.
Right.
So I wasn't suggesting we develop the housing or anything like that. I was
I
suggesting
know.
that Jen and Kay be an idea group. First I said a sub task force, but then I revised it to an idea group. They like my help, I'd be happy to help them. And then we hook up with, for starters, whoever Andrea is suggesting with the Oxford House model would be great. A Robin Gauthier conversation to get those questions answered. Our idea would be to answer those questions with all that fact finding, and that would be the first step. So,
Right, because that is what we do as a committee of the commission, is we provide input. Right.
correct, and that is what I was organizationally suggesting. If it sounded different than that, thank you for providing the clarity, but that's.
No, it's just that we have so many ideas and we have so many connections. It's, how do you put it all together? How do we make a difference?
Well,
Yeah.
and I do think what we just did, we brainstormed, who do we need? Who do we need at the table to get those answers? But those questions were exactly what I thought we would find the answers from, which then would develop some sort of model that they want to promote, that we'd like to promote. And we would be just advocates for helping to promote it. So thank you for providing that clarity. So Jen, you'd have to be the one to say, because you're leading the idea group with Kay, so just let us know if that's a good idea. And Tommy, I hope that still honors our role.
All right, thank you, Commissioner Stanley, and thank you, Vice Chair Junkat. Back to you, Committee Chair Cubine.
Yes, so as I understand it now, our main goal would be to answer those 3 questions and get them to Michael. But while we're trying to answer those, we'll be doing a little bit of investigating to be able to answer the questions, like meeting with the person that did Seaside, who is from the so that's what I understand. I also wanted to go back to Sylvia's chat. I think Sylvia was saying that she thought that this group should be called a committee rather than a task force, because we do have so many things, and that a task force is supposed to be a limit, thing. So I thought that's what she was saying rather than whatever it was interpreted.
We got some feedback from you, Committee Chair Cubine. I looked it up, and your mics might be on the next running side by side next to your keyboard. So if you have anything like brushing against that part of your laptop, that might be what's causing the feedback a little bit.
Well, should I mute the mic that's beside my name?
No, you don't want to do that, because then we won't be able to hear you at all.
I don't know where the other mic is, but I see stop mute. I see.
It might be just don't touch anything.
Yeah, yeah. I think your mics might be in a place that your arm or paper is brushing against, and that's just causing the feedback a little bit. But we're okay right now.
All right. So whether this group is a committee or task force, I guess we can address that later. But for now, as I understand it, Jen and Kay and perhaps Teresa will work on the things we said. Neither Jen nor Kay is on the Human Rights Commission, and it does seem as though someone from the Human Rights Commission should be involved, and perhaps Teresa, with her knowledge and with her ability to do Zoom meeting, maybe she would be, a part of this task force. How does that sound?
Commissioner Stanley, your mic is open.
Sounds fine. Now, because I'm just doing it as part of the idea group, it doesn't have to have public notice and all that kind of stuff, right? How many?
Nope, because it's just one commissioner.
Okay, yeah,
Great.
I'm happy to serve in that capacity, Jen, if you need me.
Excellent. Okay. So then I think we're set on that. And then the next thing on the agenda was about the videos, et cetera, we wanted to put on computer, on a Facebook for Human Rights Commission, or Facebook or the website. I sent some things in. One of them I sent in that we really thought would be good would be the a little introduction and the website for NAMI, because there's so many excellent programs. And I think I've sent some other things in, but Jen and I have talked about that and some of the different programs that are already, that people, could tune into, and we'll get together and get those in. The next item that we wanted to review is outreach to faith communities, because we had a separate meeting. It was Andrea and Ron and I that had that meeting. We sent you the minutes of that meeting. I think it was last night. Oh, heck. I don't know if you had a chance to read them. Did anybody have a chance to read them? Well, I will review them quickly and Andrea can help me. But if you happen to have printed them out, we kind of started out with reviewing what, like, for instance, we had discussed at the January 27th meet. Well, even before that, we had decided we would not try to meet with, a little noisy over there, would not try to meet with, with faith communities right now, because we wanted to wait until in person. However, at the January 27th meeting, we thought, well, maybe we could just ask to meet with perhaps IAB and the pastors group that Ron is connected with, because they both reach a large audience of faith communities. So we discussed that again, and we discussed, well, what would be our message and what would be our purpose in doing it, and did we want to do it? Well, we decided again, no, we didn't want to do it in person just yet, but we came up with some other ideas. I had already talked with Jen, and she had said that NAMI was planning to do a breakfast meeting in the fall for clergy after COVID, and that we might join in with them to do that. That would be for clergy or pastors to co-sponsor that. We know that much planning needs to be done, regardless of when that is. It probably would be in the fall. We also thought we could be using the church's media platforms to pass along mental health related links. And again, we thought the NAMI website would be a good thing to pass along to the churches, because in our discussion, we talked about the fact that not only are parishioners members of faith communities, and all of us responding to the COVID in ways that impact our mental health. We're thinking that pastors and the leaders are really having a hard time with, with deaths in the congregations and people being sick, and that we would like to get some resources out to the faith communities where they can, get some help, and that NAMI might be one, and the other one might be behavioral services that we have here in Virginia Beach, especially emergency services and CIT. Also, along that line, with May being Mental Health Month, we thought we would start collecting flyers and materials for churches that could be used during May as Mental Health Month. Now, I know a lot of the churches are opening up to some extent, so some of these things could be hard copies, at the services, and some could be on media. Now, we had talked about this, and I had hoped to speak with Teresa about this, but didn't get a chance to because I was a little late trying to reach her. We wanted to consider speaking with IAB and asking their consideration that they consider they're developing a faith and mental health initiative to encourage churches to be involved, because I've been to IAB meetings, and they, along with Teresa's help as a community organizer, they have developed so many initiatives. I don't know how many members there are. Teresa does. I know 50 at least. And they're all doing all of those things and involved, whether it's food or clothing, furniture, bank on. They've developed so many initiatives. And would it be possible for us to work with IAB so that they could develop some type of initiative that each faith community that is represented would work together to figure out how they can spread more about mental health within their own churches, temples, faith communities, whether that would be a possibility. And so that I was going to talk with Teresa and I didn't, but now she's heard it. Yes.
Just to take a moment to recognize that we got 2 minutes left and it'll be 3:30.
Okay.
But I see a real hand up by Commissioner Stanley. So Commissioner Stanley, your mic is open.
Yeah, and I was supposed to be off by 3, so I'm gonna have to run. But Tommy, I'm so invested, and by all means, yes, I agree that whatever we can do to infuse with what's already going on and active out there. There's a mental health initiative that you and Joni lead out of the IAB. But I did want to say, I think one of the strongest things we've had, and I want to go back to it, is when Andrea and Jen, I think it was you.
Yeah.
On board, IAB already took on that we would like to be able to get these resources and this awareness and this advocacy, Tommy, into the faith communities. And we did a great workshop. It was the first time
You did. I remember it too.
and CIT worked together. It was way before COVID. We did one, Ron didn't quite get as deep into the Black community as he had promised us he would, but I think he will now, because I think he really sees that connection. So that's what I'd like to see, not reinventing any wheels, go back to what we've already got. I know Andrea and Jen have that, right? You've already got that template. So I'm going to run, but that's how I think we ought to go at this, not make the work smarter, not harder. And I know the IAB, it will be happy to link, and our mental health initiative would, pave the way. So Jen and Andrea, if you're willing to continue doing that, that's, I think, the best vehicle. And with that comes all the resources that NAMI and CIT bring to bear. And those are what we want the community to be using.
Well, can I speak? I really thank you, Teresa, and we can talk further about it. One of the things I hope that we can do is not just kind of educate a certain number of people. We want it infused into the churches. And we want to look at that statement about speaking from the pulpit, so that the pastors, and I've got a whole listing of, there's a review of all of the faith communities, and it's in another state, but it's a whole paper of how they have done that. And
that's
so,
all a piece of it, Tommy. That's all a piece of that. We were trying to expand it to make sure it includes.
Exactly, that's what I'm saying.
Announcement out. And Jen brought the personal story, where somebody can share that personal. And I think the whole thing, what was it, an hour, Andrea and Jen, an hour and a half workshop? We only did it once, and it was very successful. We tried it as an experiment, remember?
Yeah, I was actually there, but it was a long time ago. Okay. Thank you.
And I'm going to run. I'm so sorry, but thank you so much. And I way over talked, but.
Thank you for your input.
Okay. All right, with that, it's 3:30, so Committee Chair Cuban, I didn't know if there was anything else.
Well, I just want to know if Andrea had anything further to say about our report from our meeting together, and perhaps, what is your response to the things we recommended?
Andrea, your mic is open.
Yeah, a big thing, Jen, that I would really like to see, and just starting with our faith-based group, is almost every church has a website, and getting a spot on there for NAMI.
Yeah.
Just like the NAMI corner, you're not alone. One little permanent thing with the website and telephone number I think would do wonders, because it's also something that someone would see all the time. And we've talked about this numerous times, how people don't pay attention to them when it doesn't affect, you're not affected by it. But all of a sudden, when you are affected, or someone who is, then you're like, hey, I think there's this thing on the church website every month, every week, whenever they put it out. So I was like, my soapbox of if we can put NAMI out there, because people do not know. I have spent all my time telling people, NAMI, 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 it's going to help you.
I know.
Everybody. So that was a big thing that I was looking at.
Yeah.
Talking about, the IAB and bringing, pulling back our show that we took on the road
Exactly.
I have everything. I mean,
There you do.
once I
Yeah.
have something, it never leaves. So
Right,
I
me
have it
too.
all on my files.
I have it all upstairs in boxes. Oh my God. Well, yeah, I agree. That was a really important point I thought that we brought out, that we would try to get that to all the faith communities. And I thought I would call my own church this week and ask how would we go about doing that? And that might be a model for how we could get it to others. And we'd have to get a listing of clerk, of all the faith communities, some way to get it done. So we'll have to think about that. I know it's over, but did anybody else have any more comments about that plan or anything else?
Thank you, Andrea. I see a real hand up by Jen. Jen, your mic is open.
Hey, I just wanted to say, Andrea, I think that's an excellent idea. I love it. But I'm going to say this. We are all stretched to as far as we can stretch. And we certainly are willing to do a pastor's breakfast in the fall. Love to do that. But as far as outreach, we don't have a volunteer to do it right now for the faith communities. When we do, we're glad to just push ahead.
Well, could I say, Jen, we were not asking you to do outreach. We were asking that we put your website on so that the groups and all you already have, they can see that, this is a place I could get some help, or this is a place my son could get, So that was what we were asking, if we could put your website on the faith communities media stuff.
Absolutely. The only thing is I'll have to step back as far as contacting the churches and saying, we'd like to put it on your website.
No, we weren't going to ask you to do it. We just wanted to use your website, and we might want to put CIT, and we might want to put something else. Oh, just the emergency services number for mental health. The behavioral health department. Yeah. So we just have to figure out how to do it. We weren't going to ask you to do that.
Thank you.
We just want to use your resources.
Thank you, Jen. Thank you, Jen.
Okay.
Okay.
Well,
Committee Chair Cubine.
I guess it's a little too late to ask if there's any more comments, because I guess we have to leave.
I don't think anyone else has anything else
I
to
think
say.
they've all left us. Thank you, everybody, for being here and good conversation.
All right. Okay. With that, I guess the meeting is adjourned. Okay. You all have a good day.
And thanks so much to everybody, especially you.
Bye. You're welcome.
Bye. Jen and Andrew.